Welcome to this Silhouette Soft presentation, which aims to help you better understand its key concepts. There are 5 key concepts that we have to consider when using Silhouette Soft. First, we need to consider the area we are looking to treat. Second is the selection of the actual patient. The third concept to consider is how to place the suture properly in order to ensure that we use the most efficient pulling point. We then need to determine the most effective vectors. And lastly, it is essential to consider the number of sutures and the correct pattern. Let's now look at each of these in more detail. The first key concept is to consider the area to be treated. Treatment with Silhouette Soft aims to reposition the superficial fat compartments. The superficial fat layer is what we are born with. It doesn't change with age and is only affected by changes in body weight. The superficial fat compartments become visible when there is sliding, which is associated with aging. There is loss of anchorage in the tissue and some volume may be lost in the deep fat compartments, which will affect these superficial fat compartments and may result in sliding of the tissue. The 3 compartments we focus on repositioning with Silhouette Soft are nasolabial fat and the superior and inferior jowl fat pads. These fat compartments slide under the force of muscle retraction, and this is why we see a deepening of folds, which is an issue our patients are looking to address. The next key concept is to select the right patient. Patients suitable for treatment with Silhouette Soft should display mild to moderate sagging. Severe degrees of sagging should be treated through surgery or combined treatment approaches, as sutures alone are not going to work in these cases. The quality of the skin is another important aspect to assess. The patient needs to have good adipose tissue, with skin that is neither very thin skin nor very thick. Third, we need to determine the most efficient pulling point. In order to determine the most efficient pulling point, we have to select the area to treat and establish where we are going to apply the pulling force. We can then determine the vectors. This is the direction of pulling, which should be as perpendicular as possible to the area to be treated. Once we have identified the most efficient pulling point and thus where the last cone needs to be placed, identified as point A here, we have to mark the exit point, 1 to 1.5 centimeters away from the last cone, at point B. In the case of an 8-cone suture, we need to measure 5 to 6 centimeters from the last cone identified as point A here, not from exit point B, to determine the entry point, identified as point C here. The exit point for the anchoring part of the suture, point D here, can then be placed 6 to 7 centimeters over the temple area. This same principle applies for the 12-cone suture, the only difference being that the distance from the last cone, point A here being the efficient pulling point, to the entry point, identified as point C here, should be 8 to 9 centimeters and 9 to 10 centimeters to the exit point of the anchoring part of the suture. This is point D here. Now for the insertion process itself. We start by inserting the distal part of the suture first. This is very important in order to preserve the correct placement of the last cone. Then we insert the proximal anchoring part of the suture. All the sutures are inserted before we actually reposition the tissues. To do this, we apply a little tension at the end of the suture and slide the skin upwards while applying gentle pressure with all fingers, thereby sliding the tissue over the cones and engaging the cones. The 4th key concept is to determine the most effective vectors. In order to effectively reposition mobile tissues, point 1 here, and fixate the suture to maintain the results, point 2 here, we have to keep the suture bidirectional and as perpendicular as possible to the area we want to treat. To determine the ideal placement of the suture, the anchoring part should be in the more dense and less movable tissue, always posterior to the masseteric ligament and above the zygomatic ligament, the yellow area in the picture, and the repositioning part always placed in the soft and movable tissue, the purple area in the image. This image is an example of an incorrect application. This is an incorrect vector, as it is not perpendicular to the area to be treated, and therefore cannot provide proper traction. This image shows the perpendicular axis that we need to apply in order to get the best vector and the best result from the suture. Finally, let us consider the number of sutures and the appropriate pattern to use. Determining the number of sutures is key to obtaining the desired amount of repositioned tissue. It is unrealistic to expect that a single suture with 4 cones will suspend the entire midface area. So, we need to assess the degree of severity of sagging and consider the suspending power of each suture versus the area we want to reposition. The more sutures there are, the more cones, the greater the benefits of repositioning, with fewer restoring forces on any individual cone and the greater longevity of the treatment itself. Furthermore, there will be a more secure collagen network to support any repositioned tissue. We have developed new treatment protocols in collaboration with experts to determine the minimum, optimal number of sutures required to maximize your results. The protocols will be selected depending on the area to reshape and the severity of the tissue sagging. The objective is to have one treatment protocol pack per patient. To treat mild sagging tissue in localized areas, either mid or lower face, we advise to use at least 6 sutures. To treat sagging of the midface, which leads to the appearance of nasolabial folds and labial commissures, we propose Silhouette Soft Recontour, 6 sutures of 8 cones. To treat sagging of the lower face, which leads to loss of definition in the jawline, we propose Silhouette Soft Redefine, 2 sutures of 12 cones and 4 sutures of 8 cones. To treat moderate global tissue sagging, we advise either a protocol of 10 or 12 sutures depending on whether the neck is to be treated. To treat full face sagging, which affects the facial shape and contours, we propose Silhouette Soft Reshape, 10 sutures of 8 or 12 cones depending on the length of the face. To treat full face and neck sagging, which affects the facial and neck contours, we propose Silhouette Soft Reshape Plus, 4 sutures of 12 cones and 8 sutures of 8 cones. We thank you for your attention.